We begin a series of videos that will go over the bones of the lower limb with the hip bones, that along with the sacrum form the base for the lower limbs, the pelvis. The hip bone in Latin is called the os cocci, or the bone of the hip. You will still sometimes encounter this Latin term, and of course the Latin purists can explain further the complexities of Latin grammar. But in English, we can simply call this bone the hip bone, or hip bones, as they are paired bones. So you have a right and a left hip bone. Both of these articulate with the sacrum of the spine to form the pelvis, or pelvic girdle. The word pelvis means bowl. Here is a bowl. A bowl, of course, contains something and has a rim, or brim. The pelvis of the skeleton also contains something, and like a bowl also has a brim, which is called the pelvic brim. The pelvic brim is the top of the bowl and is also called the pelvic inlet. Before we consider what it contains, let's look at what boundaries form the brim. Posteriorly, the sacral promontory and the anterior margins of the sacral alley contribute to the rim. Then on either side, the brim continues along the arcuate line, which then connects with the pecten pubis, which is Latin for comb of the pubis. And this is also called the pectineal line, which then joins the crest of the pubis and finally meets the brim from the other side on the superior border of the pubic symphysis. I will be going over all these landmarks in greater detail in another video. Now that we have established that we have this bowl or container, what does it contain? Here is a nice illustration of all the cavities of the body. Below the diaphragm we have the abdominal cavity, so there is a nice clear separation of the thoracic and abdominal cavities. As we go lower to the pelvis, you can separate the abdominal cavity from the pelvic cavity, but there is no clear boundary or separation between these cavities, and they are sometimes referred to collectively as the abdomino-pelvic cavity. However, we do have this bowl or pelvis, and it does have a boundary, the pelvic brim. And this is the entrance or inlet into the pelvic cavity, which has a bottom at the pelvic floor. What is in the pelvic cavity? The pelvic cavity contains a number of organs, including the rectum, the bladder, and some of the sex organs. If we return to the bony pelvis, here again is the pelvic inlet, bounded by the pelvic brim. Above this bowl, we have another container that is bounded by the walls formed by the hip bones on either side, and the fifth lumbar vertebra. But this is not really a bowl because the bony wall is absent in the front. And if there is a complete bowl here, the wall in front is formed by muscles and fascia of the lower abdomen. So this is a kind of bowl, and it is called the greater pelvis or false pelvis, and the pelvis bounded by the pelvic inlet is the lesser pelvis or true pelvis. Now let's consider what is probably the most important function of the pelvis, which is to form the platform of support for the lower limb. The hip bone is a very complicated bone, and its complications begin early in development because it results from the fusion of three bones that are seen in this nice illustration. If we look first on the medial side of the bone, we have the ilium superiorly, the pubis anteriorly, and the ischium posteriorly. These bones come together during maturation and fuse so completely that it is impossible to tell where they were joined, at least with the naked eye. But why do they fuse so completely? If we look at the lateral side of the bone, we again note the ilium, the pubis, and the ischium. And now we can see the important structure that they form together, the acetabulum, which is the socket that is going to form the hip joint. This illustrates how the three bones come together to form the acetabulum. Now I am sure you are wondering why this structure is called the acetabulum. Well, the word acetabulum in Latin means little vinegar cup. And you might recognize in the stem of the word acetic as in acetic acid, the key component of vinegar. And here is a little vinegar cup from Roman times. Now I think you can appreciate why the hungry anatomist might have looked at this structure and thought that it resembled a little vinegar cup. But let's return to the actual bone and take a closer look at the acetabulum. The smooth articular surface that would have been covered by hyaline cartilage in the living bone is highlighted here. Because of its resemblance to a crescent moon, this surface is called the semilunar surface. In the middle of the semilunar surface, there is a depression that is called the acetabular fossa. The inferior break in the semilunar surface is called the acetabular notch. This ends our introduction to the hip bone. More videos will describe this complicated bone in greater detail. There is a link in the description below to a short quiz that you can take if you wish. Here is a list of image attributions. As always, I'm grateful for images provided by the Creative Commons. And here is Apollo. He wants to come with me on a trip to the supermarket. Obviously, I can't let him ride.